Hello, welcome to your open enrollment. I'm Brad Shattuck, president of Benecom Corporation. I'm going to explain to you how the Aflac insurance programs on payroll deduction protect your income and how they can assist you 24 hours a day. The main thing that I'd like to point out before I start sharing the slides is that Aflac pays in addition to any other insurance that you have, including county insurance or private insurance. The benefits, however, are paid to the most important person, you, so that in the event of an injury or a sickness, an event, Aflac will send direct deposit or a check to your home for the services rendered on the schedule of benefits in the policy. The purpose of these benefits are to be used wherever you wish for things like mortgage, rent, your copays, your deductibles, groceries, childcare, just everyday living. So without further wait, let me go ahead and share my screen and we will begin going through the offerings. All right, the first policy is the 24-hour accident Aflac policy. Now, this policy does cover you 24 hours a day. At the top, you will see that it has an initial accident hospitalization benefit that pays you $1,500 if you are hospitalized for at least 18 hours as an inpatient. Your paycheck is $300 a day every day that you were in the hospital up to 1 year. Now, if you have cuts, burns, bruises, stitches, dog bite, bee sting, x-rays, just everyday things that can happen to anybody, you can see on the fourth grid that you can receive accident treatment at any place that you would like to go. So for example, if you go to the hospital emergency room, you can get $200 with an x-ray or $170 without an x-ray. If you just go to a doctor office or any other facility, which includes a dentist, if you break a tooth, $150 or $120 without an x-ray. Now this benefit's paid once per 24-hour period. We do have a $250 major diagnostic benefit for MRIs and CAT scans. And then for follow-up treatment, the policy will pay you 6 times $40 a visit to go back and forth to the doctor for follow-up appointments. And if you have to have therapy, physical therapy, they'll also pay you for 10 treatments. And that's $40 a visit for those as well. That's to either reimburse you if you are on the modern plan because you're paying those expenses up front. If you're on the traditional plan, these are helping reimburse your copays. Appliances are things like crutches and leg brace, etc. So they have a benefit for that. They also have accident-specific sum injuries benefit, which pays you up to $13,000 for your injuries on or off the job. What they simply do is they look up what you had done, a broken leg, a broken arm, a laceration, a broken tooth, and the policy pays a lump sum benefit, and these are just examples, for the injury. It does include accidental death and dismemberment. And it also has a $60 a year wellness benefit. Now, the wellness benefit can be used for any kind of physical that you wish. It can be eye exam, female exam, a man's physical, a child's school physical, but it is one $60 check per family per calendar year. And you will see a few other benefits that we have on here for transportation and lodging. Now, this policy right here, I'm going to go to the rates. You can get this plan for $9.84. Husband and wife, $16.14. A single parent, $17.58. And family, $25.44. And then this will be pre-tax, so you will get about a 22% credit on your taxes. So it will feel a little bit less with the pre-tax discount. All right, the next plan that I'm going to go over is the Aflac cancer insurance. Now, the cancer insurance covers any kind of cancer known to man, internal, skin cancer, all of them. The caveat, or one of the big bonuses of the plan, is that it has a cancer screening benefit that pays you $75 per person per calendar year for a cancer screening physical. Now, it has an initial diagnosis benefit. If you or a family member is diagnosed with cancer, that's internal cancer, the policy will send you $4,000 if you are the adult, $8,000 for one of your dependent children under the age of 26. If a additional or second opinion is needed, say you have a scare and they say that the test came back and they want you to have something done, we will give you money for a second opinion. Now, the policy does have benefits for radiation, chemotherapy, immunotherapy, and experimental therapy, hormone treatment, topical, the anti-nausea drugs, the stem cell and bone marrow transplantation benefit, as long as a $750 benefit one time as a donor. We do have surgery and anesthesia benefits on the cancer policy, including skin cancer. Now, skin cancer, every form of skin cancer is covered on this plan. Melanoma, carcinoma, sarcoma, basal cell, squamous cell, in situ, Clark's level 1 through 5. They're all covered on this plan. So if you have a mole that changes in size, shape, or appearance, get it checked out. If there's something wrong, we're going to pay if it's cancer, and you will get a cancer screening wellness benefit at the top here that I highlighted for the actual biopsy. The policy has a tremendous amount of benefits. I'm going to go ahead and just point out that it has a breast reconstruction, very in-depth one for breast surgery, has other reconstructive surgical procedures for cancer. It also has egg harvesting and cryopreservation. So this is a very detailed policy. It's one of the best cancer policies that's out there. It is in the top 3. So if you are interested in the cancer plan, the rates are $20.32 for individual and $20.32 biweekly for a single parent, no limit on the number of kids. You will get 20% off for pre-tax. It will feel like $16. If you are husband, wife, or a 2-parent family, it's $36.89, and you will get your pre-tax discount on that, making it feel right at about $30. Now, the next plan that we're going to discuss is the critical care insurance, also known as the specified health event. Now, this plan covers a tremendous amount of events such as heart attack, stroke, coronary artery bypass surgery, sudden cardiac arrest, third-degree burns, coma, paralysis, human organ transplant, which would be a kidney, a heart, a liver, a lung, or a pancreas, end-stage renal failure, or persistent vegetative state. So God forbid one of these happens to you or your family. The first thing that this policy will do is it will give you a first occurrence benefit. So if you are diagnosed as having that, you will get $7,500 sent to you or your spouse, $10,000 if it's one of your dependent children under 26. Now, after one of these events takes place, you are usually always in the hospital. So you will be getting $800 a day. If you're there longer than a week, it goes to $1,300 a day for 2 weeks. When you get out of intensive care and you're recovering in a step-down unit, the policy will pay you another $500 a day for 2 weeks. The plan does cover coronary angioplasty, hospital confinement in addition to intensive care, pays $300 a day with no $1 million limit. There is no limit on the plan. Continuing care will pay $125 a day for half of a year for things like home health care, hospice care, physician's visits, nursing home care, speech therapy, God forbid it was a stroke, OC therapy, physical therapy, dietary. So some more wonderful benefits that Aflac will pay you for. In addition, we do have transportation and lodging and ambulance benefits, and it does have a waiver of premium. If you are disabled, the premium will be waived month to month during your inability to pay your premium after 6 months. The premiums on the critical care plan are as follows. I'll go ahead and highlight them right here for you. I think I can get them all at one time. Let's see if it'll let me. I apologize. So critical care, here we go. Individual, 1-parent family, husband and wife or partner, and we have a 2-parent family. Now, what you want to do on the critical care is look at the age that you are on January 1, and that is the age bracket that we will lock you in forever. So as you get older, your rates will not go up. Okay. The next plan is the Aflac Dental Supplement. We've had this in some agencies of Hillsborough County for 14 years. The dental supplement is designed to supercharge your dental insurance, to provide you benefits of an additional $1,680 here at the bottom of the brochure where I've highlighted per year. And the highlights are up here as follows. So you choose your dentist, you choose them. No, it's a total freedom. You and your dentist choose the best treatment that's for you. There's no copayment, there's no deductible. It pays in addition to any other dental insurance, and you get the dental benefit check, not the dentist. Now, the caveat is in addition to the plan paying $1,680 per person per year, after you've had it a year, they will add $120 every year to the $1,680 until your policy has increased $600. So that's at no additional charge. So here's how the benefits work on the grid. Should you need to go get your 6-month checkup, your x-ray, you can go January 1 and it'll pay $35 for your cleaning and $20 for your bite wing x-ray. And that's once every 6 months. It has to be separated by 180 days per person in your family. Now, should the dentist say that you need to have a filling, the policy pays $310 for gold. It pays $70 to $75 for the white resin composite fillings. We do not pay for silver anymore. They're not doing silver anymore because of mercury. After you've had the plan for 3 months, Aflac covers pain management, and that includes nitrous oxide, deep sedation, IV therapy, literally every type of sedation. After 6 months for the children, we have another benefit called other preventative services. And if the children need to have their teeth sealed because they've lost their baby teeth and they now have adult teeth, or they need to have space maintainers because of crowding, that's covered on the plan after 6 months. Oral surgery, abscess teeth, wisdom teeth, impacted teeth, gum treatments, periodontal disease, full mouth debridement, deep cleaning, or prosthetic repair, add a tooth, add a clasp, recondition your gums. After you've had the plan for 12 months, it pays up to $1,040 per procedure, and that's good for the rest of your life. Now, crowns and major services, we do cover the titanium and high noble metal crowns with Aflac. After you've had the plan for 12 months, benefits are payable. And after 24 months, endosteel, episteel implants and dentures and partials are covered, but there is a catch. If you have a tooth that's missing now, it is not covered on the Aflac dental plan for replacement. This is not a group dental plan, it's individual. So if you lose a tooth on or after January 1, it will be covered on the plan for its different stages of reconditioning and replacement. If you are interested in the dental supplement, the rates are as follows. Okay, individual is $10.74, single parent is $18.78, husband, wife, or partner is $18.90, and a family plan is $27.06. Then for the dental, take 22% off for pre-tax discount in the county's cafeteria plan. The last program that we are going to discuss for our enrollment is the Aflac hospital policy. Now, the hospital policy covers any reason whatsoever that you have to go into the hospital. It can be sick, it could be hurt, it could be maternity, COVID, whatever it may be. The policy that we have selected to benefit will be $1,000. So if any of you were to become hospitalized for 24 hours in the hospital, Aflac will pay you $1,000. You use that money wherever you want towards your deductible, your copays, wherever you want. Now, the plan also has a benefit for rehabilitation facilities. It pays $100 a day for 15 days, limited to 30 days a year. The hospital emergency room and the short stay unit, which is in the back of the ER, it's usually the sliding glass doors where you only stay 23 hours or less. We have benefits for both of these. We will pay $100 and it will pay 2 payments per year per person for any emergency room service. And if it is a short stay, which no one knows if it's going to be ER or just a short stay, it also pays $100 2 times a year per person or per policy. And it's for a stay, as I said, of 23 hours or less. It does have a waiver of premium, and it does have additional rider benefits, which do cost additional premium. I'm going to show you the rate in a moment, but just so that you know, if you are interested in the policy covering doctor's appointments, lab, x-rays, and medical diagnostic and imaging, or more benefits for surgery and hospitalization, you can add these benefits as a rider. So without the riders, here are the premiums. Hospital is individual. You look at the age you are on January 1, and we will lock you into that rate forever. So you're in the $12 to $13 for single, and then take 22% off or round it to 20%. We have husband, wife, or partner, single parent up to 26 kids on age, and 2-parent family coverage. Okay, so that concludes all of the presentation brochures that we are offering you with Aflac. If you would like to sign up, please feel free to contact Human Resources or contact myself at our office at 813-996-2525 extension 6. My email is Brad, B-R-A-D, at Benecom, BENECOM.com. Thank you for attending open enrollment, and I look forward to serving you and your families.